Hi, my name is Catharina Thiel Sandholdt. I'm an assistant professor at University of Copenhagen, section of general practice. And together with good colleagues, I recently published the paper developing a weight-neutral health intervention in Denmark, protocol for a co-design process in the JMIR Public Health and Surveillance Journal. So our paper is a protocol paper, which means that we present what we plan to do in our co-design process of developing a complex intervention. So the complex intervention is from the Medical Research Council framework on how to test things out in a real world setting. And measure what works for who and under which circumstances, and we do this using a human-centered design approach to operationalize this MRC framework. We present a double diamond figure in the paper, where we have designed a four-phased process of developing the intervention. So what our protocol paper contributes with is how to quite practically design such a co-design process, where we in this case engage health professionals and people with lived experience with living with a high weight. So how to design a meaningful and relevant, acceptable health intervention on weight management, following the four weight-neutral health principles on stigma reduction, body acceptance, intuitive eating, and joyful movement from the Health at Every Size framework in the US. So we chose to submit our research to a JMIR journal because the Public Health and Surveillance Journal offered us an opportunity to publish our protocol study in a relevant way, because our study is not an RCT study, or it doesn't have statistical data. It's quite qualitative based, and here JMIR offered us a really good fit to really present our research in a transparent and relevant way. And the whole submission process was quite smooth and accessible. We also used the opportunity of a preprint of our paper, which was quite useful for us in terms of explaining to our collaborators, and also amongst our closer colleagues, what our intention with this study was. So overall, it was a quite satisfying process, and we can recommend it.